So it's going to be recorded. So if anyone couldn't make it on here live, we will send the recorded link out starting tomorrow. I'm sorry, Monday. So if you're new to LympheHeroes, my name's Sophie. Cam is not with us today. He is recovering from surgery yesterday. So we are all thinking and wishing him well, but I'm Sophie. I work with Women's Health Boutique and Second Silhouette here in Houston. We take care of measuring the patients, billing their insurance, being a resource for them after therapy to obtain compression garments, either during therapy or afterwards. We've got 3 Houston area locations. I would say most therapists are familiar with us and what we do. And if there's any questions or you feel like your clinic needs an in-service or a refresher on our process, we can definitely set up a future in-service. For those that have questions regarding the LymphePress or questions for Cam, he is available via email if you have any questions or need anything. Otherwise, I am going to turn it over to Jessica and Amy. They are our sponsors for this quarter's LympheHeroes, and I am going to let them do their thing. Any questions or anything regarding anything through the process, there is a chat icon at the bottom of your screen. Utilize that for questions or comments or feedback. Jessica and I will manually check on those throughout Amy's presentation. I also have some questions that were emailed to me by some therapists who couldn't actually make it live, so we'll go through those as well. So Amy, I'm gonna go ahead and make you the host, and I'll let you and Jessica get started.
Right, let me pull up my presentation. And Jessica, if you want to go ahead and introduce yourself, that would be awesome.
Absolutely. So my name is Jessica. I am your local Houston area and surrounding area sales rep for Essity. I've been with Essity for a little over 7 months now, so kind of new to the rep role. Prior to that, I was actually a compression and mastectomy fitter for roughly around 6 years. So I've kind of been in the game a little while, just on the other side of it. It's been really fun. I know I've met a lot of the therapists so far. I'm still making my way around. If you would love to kind of have an in-person in-service, feel to touch, feel, or anything, please reach out. You can reach out to Sophie and we can set that up as well. But I will let Amy take it from here.
All right. Thanks so much, Jessica. Yes, Jessica is, thank goodness she's down there in the Houston area. So I'm Amy Ewell. For those of you that don't know me, I've worked with Jobst. Well, I came onto Jobst through Pharaoh in 2014. So when BSN acquired Pharaoh, then they got me. So Kathy, as you all know, probably knew last year, or there was the MA down in the Houston area. She retired last year. So I have taken her position. I am a CLT also. I'm trained through the Dr. Votter School. So it's been a lot of fun getting out there and getting to play with the therapists, getting to play with the physicians, just kind of on the other side of the 4 walls. So that's kind of my bio. But I cover all of Texas and Oklahoma. And my job is more on the custom side of things. So like I said, you guys were very fortunate to have gotten Jessica down there in the Houston area with the fitter experience. So y'all are in great hands. But if you do need anything from a custom standpoint, I'm more than glad to do virtual in-services. I can even do virtual fitting sometimes over the computer, and then you can send it to Sophie or wherever you're sending your patients for garments. So always open to FaceTime, that kind of thing. And today I'm just going to kind of go through some of our newer garments, because some of you may or may not know about our new Relax and also the Confidence that just came out at the end of the year. So I'm going to kind of go through those, and then I've got some pictures just to kind of open it up, the discussion a little bit. kind of a case study thing. So if you have anything you want to discuss, any garments you want to discuss, just feel free and we can kind of go through those. But I'm going to start out with some of the nighttime stuff. All right. So I think one of the things as a lymphedema therapist, and I know I was guilty of it too, is a lot of times we don't recommend the nighttime compression. One, it's expensive. Two, they're bulky. And we just think it's a little, sometimes it's overwhelming for the patient to be getting so many different things when they're first starting treatment. So that's kind of why I want to go through this stuff. Some of the reasons you may need it, they're appropriate for a lot of patients. Compression is very confusing for the patient, for therapists. It's confusing for all of us because now, thank goodness, I mean, there's a lot of different options out there. So it can be very, very confusing and sometimes a trial and error type of thing. But for these patients, especially if they've met deductibles, I think it's really important to go ahead and try different things, get them in daytime and nighttime from the beginning if possible. Like I said, their deductibles are met, and a lot of times down the road, they may not have that option or their insurance may change. So if you see that, and I think as therapists, a lot of times we can tell whether or not this patient's going to have problems down the road. We know they had 15 lymph nodes removed and they're already getting some fibrosis. They're going to have some problems, probably forever. Lymphedema isn't something that goes away. But, there's day garments, there's flat knit, there's circular knit, there's night garments, there's pumps, all these different things that the patients are having to deal with. So great just to kind of know what's out there. So nighttime garments, just a little bit on them, they're designed with the compression that's safe. So while the patient is sleeping, while they're resting, it's not going to cause a tourniquet. They stay in place better. They don't gather and creep into folds and things like that. They're made thicker so that they don't slide around on the patient. The nighttime compression, it helps to maintain the reductions. So, and sometimes can reduce the swelling that happens during the day. Even with garments on, a lot of times these patients will swell just a little bit in their garments. So nighttime compression is one of those things that can help bring them back down so that when they put it on in the morning, their garment in the morning, it fits better. It can soften fibrotic tissues. Compression garments, daytime garments can do that to a certain extent, or if you're bandaging and using padding, of course, you can do that, but nighttime garments can give them a break from that. Again, there's less risk of these garments slipping, binding, tourniquet. And there's a couple of studies out there, and I'll be glad to get these for you, that the nighttime compression actually does reduce swelling. It was associated with less pain. So a lot of times these patients will be in pain after wearing their garments all day long, and if they can put on something at night, it can lessen their pain, as well as make their daytime a lot better. So as far as upper extremity, the two that I'm going to talk about mostly for the nighttime is going to be the relax and the Jovi. And one of the studies that came out, that even though we're doing all these surgical techniques that spare the lymphatics nowadays, there's still approximately 25% of breast patients that still getting lymphedema. So luckily we have a lot of things, the SOZOs, that can give us early detection, but there's still a lot of patients out there that are getting lymphedema. So if we can, again, nix some of this stuff day and night and keep it from getting any worse, then that's great. Lower extremity, relax, Jovi. Actually, they threw bandaging in here for this one. So at night, patients normally are going to do compression. It's chronic, and self-management is really important. So whether or not they're bandaging, whether or not they're wearing a Jovi, they're relaxing, we do have all the different products to help the patients with that. Bandaging, of course, is very bulky and time consuming. Most patients don't like to do it. So if we can get a nice sleeve that they can just pull on that's comfortable, then that's wonderful. Some of the benefits, I think, of nighttime compression, other than what we've already talked about, when you press foam into an affected area, it creates that tissue stretch. There's pressure differentials between there, and it allows the body to reabsorb that fluid. So just by using the chipped foam products or the relax that we're going to talk about a little more, you're going to get those things, and the body is going to reabsorb at night. It does help to maintain the hard to manage swelling. So the patients that are really struggling with being a yo-yo and going up and down, you know, again, it's just another way to treat. You can treat while you sleep. So the patient's not having to do anything. If they can get a nice, comfortable garment on and get to sleep, then they're treating that fibrosis, they're treating that swelling while they're doing all that. Better management of the limb, less cellulitis. You know, the better control, the better they keep it from getting worse as time goes, the less, hopefully, the less cellulitis they'll get. And again, we talked about this, assist with pain and discomfort. So the things that we hear patient complaints, it's too hot, they're itchy, they can't sleep with it on, they're too tired, it's too bulky. You know, we all hear all these things from whether it's bandaging or some of the nighttime garments that are out there. They did this study before we came out with the Relax. The Relax has been out now in the US for a couple of years, I think. And this was a study they did right before. I think they did this in Europe, and we're just kind of getting feedback from the patients. And they, you know, it's cooler than their other garments because it's got a moisture wicking fabric to it. They can sleep on their side. It's less bulky. So just some of the comments that we got when we first started doing these. So this is a picture of the Relax. And like I said, I'm going to talk about the Jovi a little bit too, but the Relax is the first one I want to show. This is more for your mild to moderate patients. It is a thinner fabric. So, you know, for your severe, very hard fibrosis, of course, they're going to need to go into something a little more aggressive. But for those mild to moderate patients, the patients that come home at the end of the day, rip their sleeves off and don't put on anything else till they go to bed, it's a great garment. It's soft, it's comfortable. You can still do everything in it that you do normally. You know, I can put my hands in my pockets, all those things. And the reason that they've done this, I call it bubble wrap because I think it feels, the garment itself feels like a bubble wrap if you guys haven't felt it. And if anybody needs a little swatch of it, I can certainly get those to you so that you can actually let your patients touch and feel. There is there's monofilaments in it that provide some cushioning and makes it, which is one of the reasons it makes it really comfortable. So it does provide that cushioning, that bubble wrap type of feeling. It does provide a micro massage effect, and it is a flat net. It uses flat net technology. So these patients are actually getting a flat net garment when they go into this Relax that provides that good gradient compression, and it's anatomically shaped. So again, this is just a version for your mild to moderate patients. It's a low profile. And like I said, I just haven't had any complaints on this once the patients get it because they really like it. It does have the cooling effect. It's very comfortable. So great option for those patients. Again, I think we talked about all this. There is the Cool Max yarns in it. It is cotton. There is no latex in this garment, so there shouldn't be any issues there. They can be washed and cleaned very easily. It does come in a beige and then kind of a rosy pink color. So for some of your breast cancer patients, it's awesome. There is a compression class of a 1 or a 2 in this. And then you've got your arm sleeves, an arm sleeve with a gauntlet, a knee high and a thigh high. At this time, they do not have gloves or toe caps or any kind of trunk garment. Hopefully we'll see something like that coming down the road though. And here's just some pictures of the different styles. And it's just open toe also, so they're easy to put on. That is one thing about these, they're very easy to put on. So I think a lot easier than some of the thicker garments that are out there. All right, so gonna go in a little bit into the moderate to severe patients. You know, the patients, like I said, the ones that are coming in and are already starting to show signs of fibrosis that's difficult, or you see that they swell right in front of your eyes as you take off their compression. You know, these guys are definitely going to need to be in a more aggressive type of nighttime garment. It does help break down fibrosis. It can replace multi-layer bandaging. You can get a jacket to put over it, the Jovi jacket, which provides a little bit more compression to the garment, takes it up between 20 and 30 millimeters of mercury. Again, it keeps it in place. I think one of the biggest things about patients wearing their daytime garments, and a lot of physicians tell them it's okay just to put on a lighter garment, is that they just slide around so much. So it can really cause issues with tourniqueting or putting too much pressure, too much resting pressure. It's like if you put an ACE wrap on, it's just going to continue to constrict when the patient's resting. So one of the reasons to go into these thicker type of garments. I love the picture on the far right because that arm shows somebody after being in a Jovi all night. And those are not, you notice the channels in the Jovi go straight up. These are not straight up. This is actually, you can kind of see the pattern of the lymphatics and how it's working its way up the arm. So I'm always fascinated with this picture. All right. And hopefully as we go forward, as we're using the ICG studies too, we'll be able to do more and more imaging with, daytime, nighttime garment and that kind of stuff too. But y'all are the head of it down there in Houston, so it's kind of cool to see what's coming out. Again, the Jovi packs, there is a Polar Tech fabric that does help to move the moisture away from the skin. So it does keep them, if they wake up in a sweat in the middle of the night, the fabric will dry really quickly. It's very durable. I've got these Jovis that they last people 5 to 7 years if they take care of them. Now, we can make changes on them for a couple of years, but after that, they're going to say they need a new one. So I think actually, the recommendation is to get one every couple of years. But honestly, if the patient's taking good care of it, their sizes aren't changing, they can last a lot longer for some patients. So if the money is an issue or there's going to be a time when they're out of work, this is a good way to kind of keep them in check. Jovi Pack will, like I said, make changes to them for a couple of years. They can send them in and, for $75, $100, I can't remember which it is, they'll take them in or let them out if the patient does get bigger and the garment is still in good shape. So there's those options too, instead of having to buy a new one. If insurance will pay for it, then by all means, have them get a new one. The Jovi jackets, those do need replacing because the way they're made, they do stretch out a little bit. So if they utilize the Jovi jackets, it's always good to get those replaced every year or so. All right. So goals, nighttime garments. You want to prevent further swelling. You don't want the skin to deteriorate. Preserve that integrity of it while they can. You don't want the shape to change of the limb. So all these things are great because those channels, they can make them go horizontal, they can make them go vertical. We can really help to direct that flow. The other thing with the Jovi that I like, as compared to some of the others, the chevrons that the garment makes to go where the seam is, a lot of times we found there was, because they used to do the Jovis like that also, they found that the tissue, the fluid would pool there a little bit. So that's why they started making the channels. Let's see if I can go back to, that's why they started making the channels not all go to a point. So now they go, they just angle up toward the area instead of coming to a point at the seam. All right. Okay, so just any questions about nighttime thus far?
I don't see anything yet.
Awesome. Y'all are going to be a quiet group. All right. Let's see. We're going to go into our newest garment now.
Oh, Amy, I have one.
Yes. Okay.
As a CLT, do you recommend patients using their foam chip garments while using their pneumatic compression devices? For instance, a Jovi pack with LympheHeroes.
I was going to say, this is a great question for Cam, but I know that he does use chip foam under his LymphePress, and I have recommended it myself, absolutely, especially if they've got a lot of fibrosis. There's nothing wrong with doing that at all.
That's it so far.
Okay. All right. So confidence. This is our newest garment. It just came out back in the fall. It was already launched in Europe, but this is it's really kind of a game changer to the garments that we have thus far, and it is a flat knit. So this again is one of these mild to moderate lymphedema patients. If you've got a really severe patient, it's not strong enough. This is a great garment for those patients that are new to flat knit or really bucking getting into flat knit garments because they're thick, they're, whatever they have to say about all those things, they can't move in them. This confidence, it's made out of cotton. It is very flexible. It's done on a 3D machine. It's a brand new machine we've gotten, and it does provide lots of freedom of movement. It does have a wicking material. There's two layers in there that actually pulls it away for moisture management. It's very skin friendly, easy to pull on, so it just makes it so much easier. All the patients I've put in this have just absolutely loved it. Of course, Elvarex is going to be your gold standard for flat knit. So again, if you've got that patient that has severe lymphedema, of course you're going to want to put them in our Elvarex with the rubber core. So they offer the best in comfort containment. Patients that have shape distortion, skin folds, lobules, it bridges the skin folds instead of working its way into them. The natural rubber core, is great for patients of all sizes and shapes. You can do them over lobules. And it provides that fabulous containment that when they wash and wear it, it's going to rebound and kind of take on their size. So they should not be swelling in an Elvarex at all. I always say, and if a patient is swelling in their Elvarex, then we need to bump it up a class because there is no way they should be swelling in that. If there's an issue getting it on, then there's things that we can help as far as that goes, donning it. They should not be swelling in their Elvarex. There is 80 UV protection in them. So that's kind of the Elvarex versus the Confidence. Confidence does have some UV protection in it also. I think it's 50. So a little more into the Jobst Confidence now. Again, it is that contour fit, great for the different body shapes. I found that it's also really nice for your lipedema patients. Pain sensitivity patients, they seem to do really, really well in this because it is so form-fitting. It stretches in 4 directions. So again, because it's done on that 3D machine, it is a much more contour fit. When let's see, you'll see this is the picture here. There are contour points. You'll see little knitting marks in the fabric itself. If you were to see that on an Elvarex, of course, you would want to return it because there's a snag in it. But with the Confidence, you're going to see the little knitting marks, and that's actually how it's doing the contour. So for a patient with a distorted limb, you're really going to see those contour marks around the distortion, whether it's the calf, at the ankle, or wherever it may be. The moisture management, we kind of talked about that. There is that layer that kind of wicks it away. Very soft yarns that go in here, and it's all, like I said, a cotton design. So the garment just feels extremely soft. Right now, we have introduced it as a knee high, a thigh high. That's actually not on this slide. A thigh high we do have, and an arm sleeve. There are no toe caps or gloves at this time, but they will be coming. And then in the fall, we should have the waist high. So, and then hopefully by next year, there'll be more things that'll be introduced in the first quarter of next year. But right now, like I said, knee high, thigh high, and arm sleeves. Class 1, class 2 for the upper arm, lower, and for the leg, class 1, 2, and 3. So we still do have a class 3 in that lower leg. Oops, wrong way. All right. Some of the design options. You can put a deco line down the front of this garment. I don't really know why people would do that, but it is an option. You can also put your initials on it. It will come with a J for Jobst, and then you can actually add your initials to the bottom. You know, I found this is actually a nice idea for the left versus right. You can put, you know, LT or RT on it so that they know which leg is which for those patients that have different size legs, or they can label one and not the other. Some of the comfort options, of course, you can do the functional zone slant toes just like you can with regular LympheHeroes, and the fun colors that are on the side. So these are all kind of a heathered look. The beige and the black are close to the LympheHeroes colors, but and the caramel actually, but the others are more of a real heathered type of look. So it's a casual, more of a casual sock. And again, they're going to get that freedom of movement. Well, I put the measuring form on here, especially for you, Sophie, but I know that some of the therapists also measure. So great opportunity to kind of look at this. We are redoing all of our forms to have the plus signs on here, but this garment is measured much more snug than LympheHeroes. So there is a difference in measuring. So for those of you, if you measure on your own, I can do one-on-ones, or Jessica can, to get the fit right on these. You are pulling at all places except for Y. So even at the top of the garment, you're putting tension on there so that this garment will stay up. I say it's done more the German type of measuring, because they pull really, really snugly. And I apologize for my dogs. But again, the measuring is a little bit different. And we did add on the arm, there's an extra measure that needs to be done. So if you're measuring these on your own, just know that it is different.
We have a great question from a therapist.
Sure.
How do I determine what type of garment is the best for my patients?
Great. That is a great question. Man, that's the question of the day.
Absolutely.
So, you know, if a patient is a true lymphedema patient, I definitely think lymphedema patients need to be in flat nets, not off the shelf, or as one of our MAs calls them, socks in a box. Those are great for your vascular patients, but circular knit with patients with lymphedema can dig into folds. It can also, I think the flat net also provides a massaging type of effect. So it actually stimulates the lymphatics to kind of pump out of there. Again, it's custom measured for them, so it's going to fit them a lot better. They're going to be happier, and they're going to be more compliant with wearing it. LympheHeroes, of course, has a rubber core. We do have one that has a synthetic. So if there is a latex allergy, they can certainly go into the synthetic version. I think containment is not quite as good in the synthetic soft. So if they need a lot of containment, you're going to want to put them in LympheHeroes. If they need, you know, they can't tolerate LympheHeroes, of course, put them in the soft. And then we also have this new Confidence, more for your mild to moderate. So stage 1, stage 2, patients that are just starting to be introduced to flat knit may have a little bit of swelling. You know, they went down very fast. They're great for this new Confidence garment. But your very difficult patients definitely need to be in LympheHeroes. They probably need to be in class 2, class 3. And, you know, Jessica, I know, is willing, and I'm more than willing to do this at any time. If you have questions, you want to shoot me a picture, you want to just call and say, hey, this is what this patient's dealing with. What class should I put them in? What type of garment should I put them in? I'm more than glad to help with that. That's the fun part of my job, I think.
We
Hopefully
love being
that
a
helps.
resource.
Yes.
So here's another one. From a manufacturer standpoint, what is a recommendation of when to replace daytime garments and nighttime garments?
Daytime garments are recommended every six to 9 months usually. I tell patients, you know, depending on how good a care they take of their garments, they might get a year out of them. But if they are starting to swell, it is time for a new one. And that's just kind of my go-to. If you notice that you're starting to swell, nothing else is going on, then it's probably time for a new one. Nighttime, you know, every couple of years, usually on those nighttime garments. The Relax is still pretty new, so I'm hearing on those. I've heard some patients getting a couple years out of them. Sometimes they're stretching out at the top, and that is something we're working on, but 1 to 2 years on the Relax right now, just as wear and tear goes.
Perfect.
Anything else?
That's all I got for right now.
Awesome. Okay. All right, measuring. And this is Shauna. She has a great video too. I didn't share that with you guys today, but she's one of our medical advisors up in California. She does have lymphedema, and she has switched over into our Confidence brand. Right now, she's only wearing the knee highs. She does have some thigh highs too, but they're a little. As you can see with her shape, she's a little bit more of a difficult fit. She's never really been able to wear our garments. The soft she could tolerate, but still it kind of bugged her. They bit. They were. She just says they weren't comfortable, but she swears by the Confidence. She says she can't even tell they're on. So, and she's had this now for 20 or 30 years. She's been dealing with the lymphedema, and she's tried all kinds of garments, and you know, her weight's gone up and down and all of those things. But yeah, she's a great testament to the Confidence socks. So yeah, I always like to throw that picture up there. All right, let's see, how are we doing on time? Oh, I got a few more minutes here. Okay, I just want to kind of throw some of this stuff out there because I think it's important for therapists to know that these options are there. Custom seamed is something that doesn't get nearly enough attention. You can do anything with it. This is sewn in Hickory, North Carolina. It is sewn by seamstresses that cut out the patterns so they can fit any size, any abnormality, amputees. It just doesn't matter. They can do anything with this fabric. It's the original Jobst fabric, of course. So know that if you've got that patient, the burn patient, the patient with like I said, with the abnormality or an amputee or a divot, this is a really nice garment for them. Trunk garments. They make really nice trunk garments with zippers. They can put linings in there so that it's a little smoother on the surface. So I always do like to throw this out there. It also is measured very differently, and it could be a whole day seminar on this thing. So again, if you have questions on custom seam, please reach out to Jessica, myself, Sophie. You know, we can give you more information. Release, something else that's kind of overlooked sometimes for trunk edema. Great garment. It gives great compression around the torso. It goes up high underneath the axilla. It's got a little gusset there. So I think a really nice way to really get some of that swelling that's up above the bra line. There's a zipper in the front, and on the back, this picture doesn't show it well, but on the back, there's actually hooks and eyes that go all the way down, so you could fan it out if that patient has a larger torso or a larger belly. There's also extenders you can put in there, and the straps adjust also. So great versatility with this bra. It is a polyester nylon spandex though, so if any of your patients have issues with that. I do have a lot of patients that sleep in this also, and there are pockets in there. They can put in prosthesis or they can put in pads. So with all the Jovi pads that are out, the patients can actually add those to this bra to even further decrease the fibrosis that they're getting in their trunk wall. And again, I think this is an area that's overlooked a lot, is the patient's trunk. All right, patient discussions. I'm just gonna throw this first picture out there because I know a lot of us are getting PD patients, and this is one of my PD patients, and just some of the things that can be done from right to left. This is something that a therapist designed on her own up here in Dallas. It's kind of based on the ENA sleeve that Jovi does. And Jovi was able to put this together for her. It's basically got our cotton liner underneath, and then on top they did the power sleeve type fabric with Velcro so that it could be adjustable. This is for a 2-year-old little girl, and that one's actually her favorite. The next one, the pink one, is a traditional Jovi, just for the hand. And her problem was mainly in her hand, although she is starting to get it in her arm now, but mainly her hand and wrist area. Again, you can see the power sleeve over it. This is a custom seamed garment, one that I just talked about. They can make anything. And then we've got a regular Jovi that went all the way up. And then, whoops, I have to be careful with this one because on the far left, one of my therapists took a Pharaoh and a trim to fit Pharaoh and made her own. So we can't really endorse that, but again, for some of your little guys, it was a nice option for the patient who was very, the patient's mom was very with it and able to, was not going to damage anything. All right, so I'll stop there. Questions?
Okay. We have another question that came in. Within the Jobs product offering, what are some preventative garments that you'd recommend?
Preventative as they don't have any swelling?
I would assume so, yes.
Yep, okay. Yes, so we do have our Bella ready to wear line. There is a Bella and a Bella Strong, and it comes in a 15 to 20 and a 20 to 30. And there's also a gauntlet and a glove that they can get, and they're all, like I said, mild, off the shelf. And as long as they fit within the measurements, then that's really a nice thing. So one of my clinics up here in Dallas has actually started, the minute they trigger on that Sozo, they're putting them in flat knit, and they are getting tremendous results with patients not having to come back. Now, is that over compressing? You know, I mean, the gauntlet's out on that one, but that is one thing that they are doing. But yeah, our Bella line is fabulous too.
And that's all I got for right now.
Okay, Sophie, how long I got?
You have about 10 to 12 more minutes.
All right, okay, let's do some case study stuff then. Okay, this gentleman, whoops, I didn't turn that picture sideways. This is a gentleman I saw that had to have a flap done, a muscle flap on his arm. I think he was in a Jeep accident that rolled over. You know, of course, having a lot of problems getting a garment that fit him well. His hand, it doesn't show it in this picture, but his hand was really, really swollen. This is a great example of what we could do with a custom seamed, because you can see the big indention on that picture on the right. We were able to do a custom seam garment, and they put a silk liner in there. So it was a lot more comfortable for him, because he did have some sensitivity issues on that arm. So again, really looking at those burn patients, those patients that come in with abnormal issues, sensitivity, because they can really do a lot with that garment. So that's the first one. Second one, I just love this picture. I just saw this patient last week. She cracks me up. Obviously, there are many things wrong with this garment. This is, I think I fit her now 3 times. The knee, she does not pull it up high enough. So she's very determined, but she doesn't have a lot of mobility, obviously. She's sitting in her wheelchair. She just yanks and pulls on that garment. She lives alone, yanks and pulls on it. She gets it on, but not very well. And you can see the toes she ripped. So she just folded it back over herself. I've tried to put her in Pharaohs. I've tried to put her in all different kinds of things, but she loves her flat net, and that's what she wants, and she pays out of pocket for it. So like I said, I've donated all kinds of things to her, but she's always wants to go back to this. So my new thing with her is I think she's going to be a really good confidence patient. I'm going to put her in a class 3. I think that it will do, and it's not in yet. I've measured her, but it is not in yet. And one of the reasons being is that the way she tugs and pulls and has all the different lobules, I really think that it's going to hold her even better than this LREX does, because this LREX is only a class 2. And she just struggles so much getting it on. So good example of the patient that is trying really hard. She won't use donning devices. We've tried those. So again, and you can see the hole down there on her foot where she grabs and pulls and tugs. So I really think because of the ease of being able to pull that on, she's going to be able to get it all the way up to her groin. What you can't see in this picture is that her top of her leg, the band on the silicone band on the top is actually ripped away from the garment because of the way she tugs and pulls on it. So again, great example for what we're going to try for a confidence garment, because I really think that it's going to be beneficial for her and fit her better and be able to get on. All right, so that is all my case studies. Does anybody else have something they would like to discuss?
I have one other question in the chat.
Throw out there. Awesome.
It says, I have a lot of Medicare patients who cannot afford several garments and insurance does not cover. What are some good Velcro options that can last and can be utilized for both day and nights?
So the first one that comes to mind, of course, is the ferrule wrap. I like those because I think they can be used day or night. The patients can loosen them up a little bit at night. They are short stretch. They are, the patients don't have to use a measuring tool of any kind to get them on. They can just kind of, as long as they feel that resistance and overlap, they are going to get that 20 to 30 or 30, 40 compression on them. And they last. You know, some of them may not look pretty after a year, but they still hold up really well. And as long as you put that fabric on a stretch, you're going to get the 20, 30, or 30 to 40, and the Velcro is going to stick. So that's my favorite, my go-to, of course, for the patient that's going to do day and night time. I've got a lot of patients that actually will start out in a ferro, you know, for reduction, and they stay in it. They, even after, when they're eligible for a compression garment, even though they could get one, they prefer their Velcro wraps because it's easier for them to get on and off.
Absolutely. Well, that was the last one I see.
All right. You guys are awesome.
Lots of good questions that we had come in. So I appreciate those therapists that sent those in advance. Thank you, Amy, for doing this. We really appreciate it. There were a few things that even me, myself, needed a little refresher on. So I appreciate
I'm the same way.
I know. Sometimes the little thing, it's like, oh yeah, I forgot about that product.
And I learned from my therapist. So like I said, you guys feel free, please reach out to me, because I learned from you guys too. And that's how we make better garments. You know, when we hear the needs that are out there, that's how we know what to do.
Absolutely.
Well, thank you. And Jessica, again, and we'll make sure to include, Amy, your contact information, your email, and Jessica's as well when we send out the recorded link, so that therapists can reach out to you guys directly for questions or samples or additional in-service. And I think that's it. So we thank everybody again. Our next meeting will be the last Friday in June. So we will be sending out a save the date for that. And I think that's it. Any other questions from anybody else? Thank you again, Amy and Jessica. And we will see you guys next time.
Thank you, everybody.
Yes,
Bye.
thank you. Bye.